Well, my name's Pete Wedderburn, and I'm a vet in a 4-vet companion animal practice. I'm one of those people who always wanted to be a vet. I was 5 years old when I decided that's what I wanted to do with my life. And after qualifying initially from Edinburgh, I went into overseas work. I spent a year working overseas, studying cattle ticks in Africa. And after that, I came back to work in the Scottish borders. The job of a vet is often painted as being a bit glamorous and kind of exciting and interesting, which at times it is. But it's actually, I think, a lot more stressful than most people realise. The rate of suicide and alcoholism and depression amongst vets is very, very high. It's the highest of any profession. And people kind of wonder how that is. Well, I'll tell you how it is. It's because of the stress that's involved. If you're dealing with somebody's much loved pet who's like a member of their family, and you've got to break bad news to the people that their pet's going to die soon, or that it has a very serious illness that's going to cost them a huge amount of money, you know, this is a very stressful thing to have to do. And you have to do that several times or many times during a day. And I can tell you something, what adds to that stress is when people come into you suspicious of your motives, thinking that you're almost accusing you with their eyes of trying to fleece them in some way. It adds to our stress as vets. You know, we really are not doing it for that reason. And it's quite hurtful when people make that sort of accusation. When there's a lot of stuff in the media about you know, a negative perception of vets, it's very easy to get too defensive, and I'm very wary of doing that as well. I don't mean to be defensive. I don't want to defend vets who are doing wrong. At the same time, I want people out there to realise that those ones are the absolute minority. Think about your own vet. Think about the work that they do. Do you think they're really trying to fleece you? I don't think so. Now, the complicated thing is this, that doing the best for animals is expensive. It involves lots of blood tests, lots of x-rays, ultrasound, CAT scans, MRI scans, complicated medical treatments, complicated surgery. Now, all those things put together make up a very large amount of money. And the catch for vets is that they're the ones that get that money. And that means that whatever their intentions, the perception can be that when they recommend lots of work being done, that they're being motivated not by what's best for the animal, but rather by the money that's coming in. Now, I know of very, very few instances where people are actually motivated by that, but I know also that the media at the moment seems to be suggesting that the majority of vets, that's what it's about for them. And that's just not true. At the same time, vets do need to recognise that people have limited funds. And so I think that what we need to do is we need to all be clear that, you know, although we know what's best for the animals and that that's expensive, we need as vets to be able and ready to give people options and to allow them to choose which option they want without making them feel bad in some way because they can't afford the most expensive option. And so vets, if you ask them, they will be able to offer you different approaches. I would call them a bronze, silver and gold approach. The gold approach is what vets like to do for their patients, and that's one of the reasons why we like it when pets are insured, because we can just give the gold approach without even asking the owner. We just do what's the best for them. However, the silver approach means cutting out some of the extra tests and some of the perhaps more complicated procedures that are the icing on the cake, but they're perhaps not absolutely necessary. And the bronze approach means just giving the very basics and doing things absolutely on a shoestring, and there's a higher risk of complications, and it's not ideal, but it's better than what I would call the black approach. And the black approach is what happens when people can't afford any treatment at all and they simply opt for euthanasia. And I, like most vets, would do anything to avoid the black approach. Nobody wants to end an animal's life when there's some treatment that's possible. I think the important message for people is talk to your vet and ask your vet questions. And don't feel pressured into taking any course of action. You're the owner, you've got your budget, and you're the one that decides what happens. But talk to your vet and find out what else is on offer. And you know, in most cases, an answer that's appropriate for your pet can be found.